Hello, everyone. It's November the 9th, Monday. And today is going to be a terrible day from the standpoint of what I have to report to you. I have many deaths of great West Virginians to report to you today, and every last one of them needs to have the respect that we pause just a second, to read the number of their death and their, whether they be male or female, and whatever county that they may have reside. We have 17 additional deaths today that moved our total up to 503 deaths in West Virginia. I'm going to read these 17, but in addition to that, throughout time, we have had additional deaths that I guess we have been investigating and everything as to whether or not they were COVID-related deaths. And now we have either confirmed these additional deaths to be COVID-related, or we have labeled them as probable deaths to be, COVID-related. There are 27 of them, and 17 additional since last Friday. Now, I'm going to, and in addition to that, if that's not enough, our dashboard has had some technical issues, so I do not have this morning's update yet. As soon as I get that, I will tell you. But I have several deaths to call out and ask all West Virginians to please not let these people feel alone. Not let their deaths just go unnoticed as we struggle in this state, as all across this nation and all across our globe with this terrible killer, this pandemic that has swept across all of us. Without any question, we could have a great deal of animosity towards China because, at the end of the day, it surely seems that they made some judgments there within that country that were not wise, and it caused an incredible amount of pain and carnage across the entire globe. But nevertheless, our 487th death is a 72-year-old female from Mingo County. Our 488th death, a 52-year-old male from Mercer County. Our 489th death, a 72-year-old male from Raleigh County. Our 490th death, a 67-year-old male from Mingo County. Our 491st death, an 85-year-old female from Cabell County. Our 492nd death, an 80-year-old male from Fayette County. Our 493rd death, a 68-year-old female from Work County. Our 494th death, an 83-year-old female from Marshall County. Our 495th death, a 59-year-old male from Cabell County. Our 496th death, a 49-year-old male from Summers County. Our 497th death, an 80-year-old female from Summers County. Our 498th death, a 77-year-old female from Preston County. Our 499th death, an 82-year-old male from Boone County. The 500th death in West Virginia is a 90-year-old female from Boone County. Our 501st death is a 98-year-old female from Boone County. And bless her heart, 98 years old, 98 years young. It's amazing. Our 502nd death, an 83-year-old male from Kanawha County. Our 503rd death, an 80-year-old male from Berkeley County. Now, those are the people that we've lost since, over the weekend, that have been reported to me, I guess, that have happened since, and this is saying since Friday, since Wednesday. Is it Friday? It's Friday? Yeah. Okay. Now, the additional deaths are cumulative throughout the entire period, and we're just getting confirmation that some of these, that these deaths, have now either been confirmed or labeled as probable to COVID. Like I said, there's 27 of these. Our 504th death is a 77-year-old male from Boone County. Our 505th death, an 88-year-old male from Brooke County. Our 506th death, a 93-year-old female from Logan County. Our 507th death, an 80-year-old female from Fayette County. Our 508th death, a 54-year-old male from Fayette County. Our 509th death, an 85-year-old male from Harrison County. Our 510th death, an 85-year-old female from Jefferson County. Our 511th death is a 77-year-old male from Kanawha County. Our 512th death is a 69-year-old female from Kanawha County. Our 513th death is a 69-year-old female from Putnam County. Our 514th death is a 95-year-old male from Kanawha County. Our 515th death, a 93-year-old male from Kanawha County. Our 516th death, an 81-year-old male from Kanawha County. Our 517th death, an 88-year-old female from Kanawha County. Our 518th death, a 63-year-old female from Kanawha County. Our 519th death, a 78-year-old female from Kanawha County. Our 520th death, a 73-year-old male from Kanawha County. Our 521st death, a 54-year-old male from Fayette County. Our 522nd death, a 76-year-old female from Raleigh County. Our 523rd death, a 78-year-old female from Logan County. Our 524th death, a 79-year-old male from Putnam County. Our 525th death, a 75-year-old male from Putnam County. Our 526th death, a 70-year-old male from Putnam County. Our 527th death, an 86-year-old female from Putnam County. Our 528th death, a 76-year-old female from Putnam County. Our 529th death, a 78-year-old male from Raleigh County. And our 530th death in West Virginia, a 76-year-old male from Mercer County. Now, oh boy. Let me just say this too. The work of all these people, it doesn't stop because we've just had the weekend or whatever and everybody's out hanging out and everything. Everybody's still working. And I'm very proud to still be working during that period. On Saturday, Dr. Marsh, after the panel goes through the education map update and the color coding, they call with the results of what they've come up with their Friday and Saturday morning perusing of all the situations with all the counties that are every color, gold especially, orange especially, red especially. And they tell me. And then I go through the numbers and everything, and then if I have, anything to be concerned about or anything that I want them to additionally dig into, I say, go do this. And they go back and they work and they continue to work. Now, and the work continues to go and they continue to call Now, I've said this over and over and over. I've said that I, of all people, being a coach, recognize how hard it is for our kids and coaches and parents and everything. I know how hard it is because I've seen it firsthand. I mean, for crying out loud. I've said it over and over, but my team was getting ready to play a game against an opponent that we'd beaten the regular season by 25 points, and we would have been in the Final Four in the state tournament, as sure as I know my name, and we would have had a real shot to win it. You know, those kids were within hours of playing. They had come to Charleston the day before. They had spent the night, they had practiced, and we were within hours of playing when we pulled the plug. Well, it was tough stuff. Now, I am telling you, you have just heard me read, good gracious, 44 great West Virginians that we lost. I am telling you that I know how important the sports are, and I have tried with all in me to help any and every one of our teams, and absolutely had our experts just bear down, check, and check. Now, in doing so, you know, we've had situations to where we were told by the labs have all this work done, and we were told that it would all, you know, here's what the results were, but we didn't have it directly in our hands. And what we did then, because the labs had given us this information and we were absolutely certain of the information, we still did not come out with the map, you know, and we delayed a few hours because we absolutely wanted it completely confirmed and in our hands. Now, we have tried upon tried to do all we possibly can, except one thing, and that's just this. We know there's going to be some sadness, and we know that sometimes the most innocent are going to be involved, our children, our athletes, or whomever it may be. But we've lost 44 more people in West Virginia, 17 since Friday. And who knows what the report's going to be this morning. It will surely probably add to the 17. Now look, I'll promise you this. I listen to the experts. Our experts are absolutely working this as hard as they possibly can. It's high time, West Virginia, that we absolutely realize that sports are important, but they absolutely have to be laid to the sidelines just a little bit. Sports are important. I'm a coach. I get it. But school's more important. And surely to goodness, we can't go to school. We don't need to be playing. In addition to all that, what is way more important than anything is to try to find a way to keep these people from dying. Now, I read to you the other day, and I'm not going to do it today, but I read to you the other day about the counties that were really after it and really testing and everything. And really, if I remember correctly, Berkeley County was one that really aggressively got out ahead of this and really started testing. And the results came out in a good way with Berkeley County. That's what you got to do, West Virginia. If we're going to stop this, we've got to test. We have to test and test and test. Now, I haven't asked you, West Virginia, to pay for the test or do anything like that. In fact, I have pushed our National Guard and our health departments beyond belief to come right to you in every way to make it so absolutely not convenient, or convenient rather. Make it so convenient for you to be able to get tested. And there are counties that have responded, and there's are counties that don't. And if you don't, what in the world do you expect any of us to do? So I hate it. I hate it like crazy for some of our teams. You know, they're some of the most innocent and everything else. At the same time, I hate it worse that we can't be in school. And I absolutely hate it way worse that we got people dying. And I know just as well as I know my name that if we would test more, we would be able to help and to maybe save 4 lives, 12 lives. What do they cost? I mean, what is the cost? You know, you can't describe that, and neither can I. And so please, we've got to go get tested. Now let me tell you this. This morning, it came right across all of our televisions. You know, I told you this on last Wednesday. But somebody asked the question or whatever, like, how much do our experts or how much do I look outside and try to obtain additional information and all that? And we went through all that. I told you at that time that I had talked to some really, really head docs and everything at Johns Hopkins, and they said they were sad, and you could tell that they were worn out. And you could tell really and truly that in Maryland, the outbreak is worse than it is here, and they were frustrated. But at the same time, through all that, they said, Pfizer is close. Pfizer is close to having a vaccine. And this morning, they announced that they had completed, I think, their phase 3, and they had an effective rate on the vaccine in excess of 90%. Now, what does that really mean? You know, what that really means is, and let's just hope and pray that this is the right news. This could be the biggest announcement that we have had in our lifetimes, to tell you the truth. You know, there's been a lot of phenomenal things happen within our lifetimes, but really and truly, if we have a vaccine today that will absolutely work at a level of in greater than 90%, it is unbelievable to think that we have pulled that off. Pfizer has pulled that off in the time span that has been out there to make that a reality. Now, just to tell it like it is, I mean, and again, I'm not tooting anybody's horn, but really and truly, President Trump and his team deserve a lot of credit because they pushed and they wouldn't quit pushing, and they just pushed and pushed. Now, what does the plus 90% mean? Think about this. A flu shot. How long have we been working on flu shots? A flu shot's effective rate is between 40 and 60%. Meaning if you get the flu shot, really and true, you got a 40 to 60% chance of it not allowing the flu to get all over you. From the standpoint of smallpox or measles or whatever it may be like that, the effective rate is like 92%. If this is above 90%, and they say it is, if this is above 90%, it will enable us to eradicate this, just like we did with smallpox. This is an incredible announcement. It has the stock market going crazy to the upside. It is an incredible announcement. They think that they're going to have this vaccine possibly even by the end of the month, and let me just tell you how all that'll flow. Then probably within somewhere in the middle of December, you will probably see, quantities of this being, available to our elderly or our most vulnerable people and everything. And then more will happen in early January, and probably sometime by the end of January or the first days of February, we will have mass vaccine going all over our country. This is an incredible announcement, and we got to absolutely be thankful to God above if it's a reality, and everybody seems to think it is truly just that. And it is a testimony to great American ingenuity, to science, to all the goodness that we have, and it can be unbelievable. Now, before I leave that, I've got to just say just this. How do we bridge ourselves, if this is a total reality, how do we bridge ourselves from now to when we get everybody vaccinated? How do we bridge ourselves from here to there? And there will be some that just will not get it. And if it is truly safe and truly right and everything, I'd say that'll be a big mistake. But if they check it out, I will gladly be the first one to take it, now. And I would probably, if they check it out, and I'm surely not going to take a vaccine or anything else that's not checked out, but if these experts and everything tell us that it's ready to go, then I'm ready to go. How do we get from it now to hopefully, we hope and pray this is the real deal, to when we're there? And it goes back to what we've been telling and we've been saying over and over and over and over and over. We've got to get tested. We have got to get tested. And in addition to getting tested, we absolutely have to continue to wear a mask and stay away and do all the different things that we're doing. Now, it's tough. It's really tough. And sure, it's really confusing and it's really frustrating and all that, but for crying out loud, we're so close now. So close. Just buckle up just for a little while, West Virginia, and really try hard. And all the sympathy and everything, and encourage all those kids that maybe, maybe the team is just great shape and all that, and the coaches and everything like that, and know that they're in a county and everything and they can't play. And be sympathetic to all the effort and all of what they've put in. But at the same time, we don't want to awaken to a situation to where somebody from that county is tested and they test negative, and really and truly then before you know it, a grandma or somebody like that wants to go to their game, and the next thing is we have just more and more and more potential problems. All the testing is up on the dashboard. I'm not going to go through all that. I've been long enough. The education map, we had 2 red counties, Mingo and Mineral. We had 9 orange, Ohio, Marshall, Tyler, Hampshire, Wood, Jackson, Putnam, Lincoln, and Wyoming counties. With 6 in the gold, Morgan, Berkeley, Jefferson, Wetzel, Pleasants, and Wirt counties. With 62 outbreaks in our long-term facilities, we have 17 outbreaks in our churches in 11 counties. That's Cabell, Fayette, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, Wayne, and Wood counties. I've gone through over and over. I always do it. The churches are almost a breeding ground for this situation. You got to be super, super careful there because people are singing and we want to embrace and everything else. Keep that pew in between you, wear your mask, absolutely. You hear the people that have died and their ages, and so you may want to think if you're of that age, maybe just skipping a few services and everything, and so we can get this vaccine and you can have services for multiple years, if not decades to come. Our corrections has 3 positive inmates, 1 in our southwestern regional jail, one at Denmark Correctional Center and one at the Charleston Community, and one in our Charleston Community Correctional Center. We had 38 active staff cases. Another round of full facility testing is taking place at our Clarksburg Veterans Nursing Home, and will take place today. And after finding a positive staff case, a staff person, and so we're continuing to do another full round of testing in order to make sure this doesn't break out, all through our veterans nursing home. I've told you to get your flu shot over and over and over. It's still out there. You need to do that. You surely need to do that right now. We've gotten out $173,596,000 to our cities and counties, or that has been awarded, and we continue to do so and continue to encourage them to keep at it. We've got a credit here, and this is interesting. Insurance Commissioner Jim Dodrell, at my direction, has approved $43 million in premium credits on all small and large group health care plans of Highmark Blue Cross Blue Shield in West Virginia. This approval will enable Highmark to provide each of its small and large commercial groups, policyholders, a one-time credit in consideration of the difficulties experienced by West Virginia businesses as a result of the COVID pandemic. This credit will help nearly 3,000 small and large West Virginia businesses. The total insurance premium relief that we have implemented for West Virginia customers and businesses due to COVID is now in excess of $140 million. Good stuff, good stuff. We lost a Supreme Court justice yesterday. Richard Neely passed away at the age of 79. Richard served as a member of the West Virginia House of Delegates from 1971 to 1973, and then as a justice and Chief Justice of the West Virginia Supreme Court of Appeals from 1973 to 1995. And Kathy and I send all of our deepest condolences to the family and the friends, and flags will be lowered to half-staff in West Virginia, to honor this great man and the passing of him with his death. And I'll announce the details later on, and we'll finalize more details and everything. But Supreme Court Justice Richard Neely, has passed away, and we acknowledge all the great service and his incredible wisdom that he gave to the state of West Virginia. And thank you so much, sir, and thank you for his family, and please keep them in your prayers as well. Got one more thing real quick I want to tell you about Hyperloop. Yesterday, it came across all the wire services today that Hyperloop has completed its first passenger ride. So now they have tested with a human. They reached speeds. They didn't really probably push this thing as much as they should, or not should, but could. The pod reached a peak speed of 107 miles an hour at the company's test site in Las Vegas, Nevada. Just a month ago, Virgin Hyperloop picked West Virginia, and get this, to host a $500 million certification center and test track that will serve as the proving ground for this incredible technology. They will build the Hyperloop Certification Center on nearly 800 acres of land, spanning Tucker and Grant counties, and leverage intellectual capital and resources from West Virginia University, Marshall University, and all across our state. So we made the announcement that Hyperloop's coming. They continue to make advancements. We should be very, very happy for them. They're going to come to West Virginia, and absolutely it is additional validation to the world just how great we are in West Virginia and how good we are. So great stuff happening at Hyperloop, great stuff happening at Pfizer. Lots and lots and lots of prayers for Chief Justice Neely, for all of his family, for all those of the 44 people that I read today, and all those of the, and it was, let me go back because I want to make absolutely certain when I tell you this, but it's 530 great West Virginians now that we've lost, and they won't be forgotten. They're not going to be forgotten on my watch, I'll promise you that. But thank you so much.
All right, thank you, Governor. Let's first today go to Dr. Ayn Amjad, our State Health Officer.
Thank you. Good morning. As the governor mentioned, there is a delay in our dashboard today. There was a problem updating some of our data, so they're looking at that manually right now. Also, the governor mentioned about an additional 27 COVID-related deaths. COVID-19 related deaths are reported on a daily report. We refer to that as death reporting data that is given to our local health departments by multiple providers across the state. These health department reports are then immediately reported to our Office of Epidemiology and Prevention Services. These deaths were not reported over the course of several weeks to months and were flagged by our vital registration office over the weekend. Upon review, these deaths were confirmed that they were COVID-19 related deaths. 23 were confirmed, 4 were probable, as the governor mentioned. These will be updated on our dashboard today once that is put up on the website today. As a checks and balance, our vital registration office is required to report this to our Office of Epidemiology and Prevention Services. As a reminder to everyone, and we did send this out, this form is on our DHHR website, and these are reportable as immediately reportable deaths. These are category 1 reportable deaths because it's COVID-19. And we do want to remind everyone in the healthcare network to report these so that they can be reported daily to our DHHR website. Thank you.
Great, thank you, Dr. Amjad. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I wanted to touch base on 2 specific things today. Number one is that there has been a lot of consternation about the map and the color coding and why we are doing things the way that we are now doing things. So I just want to very, very quickly review our rationale to look at this map as not a school map, not a sports map, but a public health alert map. And we know today that COVID is spreading all over the world and in the United States and in West Virginia at rates that are higher than we've seen before. We have passed 50 million people infected around the world. We've passed 10 million people infected in the United States. We have had many consecutive days of over 100,000 new positive cases. And as we have discussed before, but just as a real quick review, as we started to do our public health alert map, we initially focused on just using an infection rate or an incidence rate. And that rate just totally reflects the number of positive new cases over a 7-day rolling average if counties have greater than 16,000 people, and over a 14-day rolling average if counties have less than 16,000 people, that is corrected for 100,000 population. In other words, there's no reference to how many tests are done. So therefore, if you got 100 new tests on a day and you tested 102 people, it would be the same as if you had 100 new tests a day and you tested 100,000 people. Of course, if you got 100 out of 102 people, you worry much more than if you got 100 new cases out of 100,000 people. So therefore, we decided, and what happened was, inadvertently, we started to reduce the incentive to test, because as the counties got in worse condition as far as the public health assessment, that incidence rate, the counties learn that anytime you test, you might get a new positive. So they dropped the testing. And we saw our testing go from about 6,000 a day to about 2,800 a day. And we've talked about that the real key, and the governor's mentioned this as well, the reason why testing is so important is because we need to identify the people that are pre-symptomatic or asymptomatic, who are the people that can spread to many others, the so-called super spreaders, the 5 to 10% of people who infect 80% of others. So we then changed our approach not to get rid of that infection or incidence rate, but to add a second very well established and accepted public health metric, which then complements that, which is the percent positive rate. And the goal here is to provide a different way to measure the COVID activity in our counties and in our state, but starting to look at how we can incentivize the correct behavior so that we can identify more people who are COVID positive. And remember, every time we identify new people that are COVID positive, it will initially make that incidence rate or infection rate look worse. It'll make it go up because, as we said just now, the incidence rate, infection rate does not reflect at all the number of total tests you do, but the percent positive rate does. So as we do more tests, like Berkeley County has done, for instance, then that percent positive rate starts to come down. But because we'll identify new people who are COVID positive, the infection rate or the incidence rate will go up. So initially, those two measures will go in opposite directions. And then over time, as we get a better handle on COVID spread in the community, they should both start to come down, which is really what we're looking for. But today, the problem is COVID is spreading very rapidly. And we have done, I think, a very good job in West Virginia. Each of you has done a really good job in West Virginia to date in doing the appropriate things to try to reduce the spread. Testing is a cornerstone. Contact tracing is a cornerstone to be able to identify quickly the people infected and separate them from other people. But the other thing that we really need to do is we need to make sure that we are appropriately mitigating, which on the individual levels is masks and distancing, but on the county levels may be different things, which I know the governor is contemplating about how to keep our state together, but also make sure that we are more precisely trying to do everything we can to reduce the spread in every county. Adding the percent positive rate has allowed our tests to go up. We have averaged about 10,000 tests a day over the last week or so, which is fantastic, but we need to sustain this level of testing. And so this whole MAP system, county alert system, is really designed that if counties get tested in very large numbers, then over time, their percent positive rate comes down, which allows them to stay open, schools to stay open, sports to happen. But if the testing goes down or the spread goes up, then over time, that percent positive rate also goes up. And as the percent positive rate and the infection rate go up, then we start to reduce those openings in schools and sports and nursing homes and perhaps other businesses that I know the governor is considering. So then the MAP is both a self-incentivizing system, but it's also a self-correcting system. And what we want to do is we want all those counties to come down into the gold, the yellow, and the green, which not only reflects better control of COVID spread in the county, but also allows us to start to identify those super spreaders. So the goal would be that we're not sticking with just one metric, we're using more than one, but each one of these metrics is an accepted public health metric that is recommended from groups like the Centers for Disease Control, the World Health Organization, and even the Harvard Global Health Institute has recommendations about the percent positive rate. So I just wanted to make that clear. The other thing I wanted to talk about briefly was the vaccine. And this is a big deal, and the governor reflected the enthusiasm that many people in the medical field are seeing. Just to be clear, though, the Pfizer report today was an early interim analysis of their total test. The total test needs to find in their group that they've immunized, which is about 40,000 plus people. They need to have 164 total cases of COVID-19 to look to see how many of those people got the vaccine and how many people didn't. What they found was in their early analysis of the first 94 people that only 10% of those 94 people got the vaccine, and the other 90% of people that got COVID did not get the vaccine, which is incredibly promising. And today we had a call with the Centers for Disease Control and our public health officials, Dr. Amjad, Dr. Costello, many other people, Dr. Fredericks from the National Guard, and we're really starting to solidify those plans. So as soon as a lead vaccine really does meet all of its phase 3 metrics, then we will start that distribution cycle so that we can very rapidly not only acquire all of those doses for each citizen of West Virginia eventually, but we can start to make sure that we can distribute those doses to all parts of West Virginia. And of course, there will be a priority scheme, first responders, the most vulnerable people. But, at some point in the hopefully very near future, which probably will be into 2021 at some point, then as those phase 3 studies get completed and we find out which vaccines really work, and Pfizer certainly looks like the lead candidate, then we will start to distribute that vaccine as quickly as possible with very close collaboration from the Centers for Disease Control. So things are looking up. We have to maintain our commitment to wear masks and distance and get tested, because until we get the vaccine and it's distributed, we know that more people are going to get COVID-19 all around our country, in our border states included. And so it is really, really important that we maintain our commitment to service and love and altruism for each other, and make sure that we're doing the things to protect ourselves so that we protect our vital communities, our vital and vulnerable people, and our healthcare assets, as well as our first responders. So thank you very much.
Great. Thank you, Dr. Marsh. Major General Hoyer and Secretary Bill Crouch had prior engagements today, but they will join us again on Wednesday. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Hello, this is Steve Adams with Ogden Newspapers, and my question is probably going to be predominantly for Dr. Marsh. But you opened up your comments talking about how the map shouldn't be considered a school reopening map or an athletics map. It should be a public health map. Isn't part of the problem that we technically have two separate maps? I understand that they both use the same exact metrics, one being updated every day on DHHR's website, one being the Saturday map that takes, from Thursday to apparently now Saturday at 11:30 at night to try to go through all those numbers and figure out what's accurate there and come up with how that map should look. But we have two separate maps. Parents do use this map for looking at whether their school is going to reopen for next week. And parents do use this to figure out, are we going to have sports this coming week? What's going on with that? So isn't that part of the problem? And isn't part of the problem also the fact that you obviously have gone through this explanation again for how the metrics work, why we have two separate metrics, how all this works? The fact that we have to keep explaining this, and trust me, I get questions, and I'm sure other reporters on the call get questions about this constantly. The fact that it has to keep getting explained, isn't that a sign that it's kind of failing? And that would kind of play into why you're seeing a lot of these case spikes going on right now. Thank you.
Okay, before you go, let me go.
Good.
Stephen, I think it's, I think the world of you, and you know that. I think it's really, really getting out there to think that this map is failing. I mean, what's the alternatives? Think about that just a second. The alternatives is we could have no map, and we could say, let's go back to school everywhere. Before we know it, we could have a situation that would be significantly worse than where we are today. That's one alternative. Another alternative is we could purely go by the color codes of the Harvard map. And if we do that, half of the state would be shut down right now. Guarantee it. So we go by a map that gives us two different ways or mechanisms to measure this killer in our school systems. two different mechanisms to measure what's going on and how we move and how we go county to county and how we play sports and how we do all the different things. Two mechanisms. And in that, what we have been able to do is we have been able to predominantly go to school and predominantly play sports, and yet we have very, very few confirmed cases in our schools. And from the standpoint of the teachers and all the service personnel coming and feeling safe, we've managed to do it to the very best of our abilities. So it's just as simple as this. We could say, let's just all go to school and all play ball and everything else, and we could become Pennsylvania. We could. Or we could say, let's shut down all schools and let's don't go to school, and then we would have a complete meltdown from the standpoint of people not being able to afford and having daycare and our kids not getting educated and everything else. Or we could just do the Harvard map and have half of our state shut down. So really and truly, what I am doing now is defending not the map or not the idea. I am defending the great work that our medical experts and our education experts that are all doing. And they've done a heck of a job. Sure, it's confusing, and sure, it's disappointing from time to time. But the alternative, somebody please, to God above, give me an alternative that is not going to involve half the state being shut down, or all the state being shut down, or maybe a significantly worse problem than we already have. So anyway, Dr. Marsh, talk, please.
Well, thank you, Governor, and thank you, Stephen. And I think that that the truth is that this is such a complex set of issues that is so unprecedented that we continue to evolve our concepts and our thinking to try to arrive on three really critical issues. So number one, our true north is trying to save lives and maintain the well-being of all of our citizens. And we want to do that in a way that's responsible, that is directed at the county level, more precise, but also is going to be related on enhanced testing and enhanced mitigation measures. And we saw that using a different single metric killed our testing. Our testing went way down, and that is absolutely a recipe for disaster. Our number two commitment, and the governor has said this many times, is we want to make sure that we keep our state together, that a divided house cannot stand in any way that's strong against the incredible challenge of COVID-19. So ultimately, we want to make sure that we are doing the right things and keeping the state's citizens together. And then number three is we know that there's really two sides to, closing things and maintaining areas that can be made safe to stay open. And the schools are a particularly important example of that. And so we know that at the same time that we may, some states are mitigating more differently, shutting certain things down, curfews and other things. We also know that isolation, behavioral health problems, and also overdose and deaths from overdose and drug use is starting to go up again. So ultimately, this balance between making sure that we're testing, we're really trying to focus on creating the safest environments we can and calling on our citizens to stay together and act responsibly to help each other, and also making sure that we don't leave a generation of people behind is incredibly challenging. And I would say for me personally, and I'll speak for our leadership team, is we're not perfect by every stretch, and we are trying the best we can to try to help make the best recommendations to the governor, bring the best information we can, but we're always learning. And so we also want to make sure that we're trying to simplify the way that things are done so that people understand why we're doing things and what we're doing. But the truth is that the University of Washington map, when we first started this at the very beginning, projected we would have about 1,500 West Virginians die by November 1st. Well, we're not pleased that we have over 500 West Virginians that have died, but we know that by doing this, by each person acting in a responsible way, we've saved lives. And we are committed to continue to do that and still try to balance the staying together, the making sure that we are educating our children and taking care of our children and helping people not feel hopeless. That is a very challenging set of things to achieve. And we are doing the best we can, but we're always open to suggestion. And we always appreciate critical input by you, other people from the media, as well as people from the social media world. Ayn, I don't know if you had anything else you wanted to add.
I did really quickly, Steve, and I just want to add, in addition to what the governor and Clay said, a lot of people want to use a map as a stoplight, a stop and go, red, green, yellow, and to help them decide what to do for the day. But what our map has done and what the governor has helped lead us to do is to increase communication across the state. We have increased communication partnerships with not only counties and county leaders, but also different partnerships with different healthcare leaders across the state to help mitigate the effort, which is why we do have very less deaths across the state compared to other states around the country. And what this map has done is allow us to communicate within the counties. We have talked to county superintendents, county health departments. When they see these map colors, they get to the table faster to figure out what they need to do. Do we need to test more? Do we need to increase PSAs in the communities to figure out why do we have these numbers? And that's the purpose of the map. The map is not a stagnant number, as you can see. It's a rolling number of what's going on in the community. And what we've tried to emphasize is that even if your county is green, you still have a 3% positivity. COVID is not going away. And while people want to see color and just kind of stop and go, shut things down, that is impossible right now. People need to have their lifestyle, their businesses open. So we do hear people, what they're saying. We hear the criticism. We take things into account. But life is not stop and go, as the governor has mentioned multiple times, that life needs to go on. We've tried to make recommendations of how to run things smoothly. And we are proud of what we've done, and we'll continue to work as that team to help West Virginia to move forward. So thank you.
Come back to me just 1 second, please. I really appreciate, what Dr. Marsh and Dr. Amjad have said, and I just want to add just this. We all know the downside if we don't go to school. We all know, the impact of what that has on our students from the standpoint of their learning. It's pretty easy. We all also know the fact that we've got, I don't know, but a gigantic number of special needs kids. And if we don't have school, we don't have eyes on them. We're not able to help. We're not able to help in lots of different situations that we need a level of eyes on our kids to prevent everything from drug overdose to who knows what it could be. And so we all know the downside. We all got that. We all should know the upside from the standpoint of, okay, well, let's just go to school. Let's just do anything we want to do. In fact, if we want to, let's just don't wear masks. Let's just do what we want to do, because this thing's not real. But yet every day you hear me, don't you? You hear me go through and read and read and read, and more and more have died, and more have died. If you turn on your television, you look and you see that we're well in excess of 100,000 across this country that are testing positive all over the place. You absolutely know, so you really know without any doubt, if we don't go to school, the downside impact that's going to be on parents and the hardship with daycare and all the stuff with our special needs kids and all the stuff with not learning and all that. We know that. That's the downside of not going to school. Now, the other thing, if we just open up everything, we know without question that there's going to be more and more people die. Now, we know that. I mean, there's no point in anybody debating that. So we try. We try as hard as we possibly can to have that balance and work it out. And that's what these great health experts and our great education experts do. We're completely transparent. You see every single thing, because I want everything out on the table where everybody's looking and everybody's watching. We came up with a positivity metric, in addition to the infection metric, to be able to motivate you to test. And we tell you, on and on and on, you got to test. Now, I would just say this, and I don't know how to be any more point blank. Today, if you're in a county that your color coding is not very good, just look around. Because you can look it up yourself, but just look around. And just think of how many people that you're seeing within your county. And then just think that probably in your county that 50 people, 37 people, 17 people, maybe 0 people showed up to get tested. All you had to do, all in the world they had to do was come out and get tested. And if they did, the likelihood of you being in a better color would have happened just from the standpoint of them showing up. But the biggest likelihood of all is we would have been able to identify somebody within your community or somebodies within your community that would absolutely aid and help us to saving additional lives. You got to show up. You got to look around. There's really no need in you calling and looking at Clay Marsh or Dr. Almjohn. I don't care about you calling and looking at me because, I'll take all your calls. I'll take them respectively and absolutely do the very best that I possibly can because everybody's just doing that. But really and truly, at the end of the day, you just need to really look around. Look around. You can see it everywhere. Look around and say to yourself, how many people did I see yesterday? 1,000? 100? 700? Well, there's a whole lot of eyes that are out there within your county. And maybe 0 showed up to get tested, or maybe 61 or 47. In Berkeley County, thank goodness, we had days in excess of 400 that showed up. In all honesty, that's the only way that we're going to find out, and that's the motivation that we came up with. The positivity rate, the metric there, was to get people to test. The infection rate demotivated people to test, and we were going right in the tank, and so we had to come up with another rating. This isn't perfect. I get that. There isn't a playbook, and I get that. And really and truly, these experts are doing a heck of a job. Everybody here sympathizes with the problems, and everybody understands, just the ramifications of a situation to where a ball team's really good, or we can't go to a situation, we can't go to school in a county. We all get that. And we all get the sacrifice level that we're having to make all across the board. It's not any fun, and I get it. And I'm surely sympathetic to all those that have put in a lot of licks and then get disappointed by what's happening with the color code. I'm surely sympathetic with the confusion. But absolutely, these people are doing a heck of a job. And the results of what they're doing will probably go unnoticed. But at the end of the day, they have done a whale of a job for a lot of great West Virginians. So I thank them and thank you all for the question. And I know that they'll take any additional thoughts and ideas, and we're continuing to evolve and make things better. So just go get tested.
All right, thank you, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, it was announced last week that Charleston Area Medical Center's CEO will be paying the frontline health care workers at that hospital $1,000 as a bonus for working through the pandemic. I know that was discussed here on the news briefing several times. I asked questions about it several times. And you had said at some point that you'd be open to that, obviously. And I'm wondering if your administration ever had a chance to talk with CAMC and was a part of that decision to pay those healthcare workers. Thank you.
Kenny, I appreciate the question. I have not talked directly, to the people at CMAC. They're a private business. I love it, what they've done, and everything, and I applaud them in every way. I have encouraged the people within my administration to have ongoing talks with them and everything. I have not talked directly to them myself, but I think it's great, and we've tried, within our house to be able to pay out dollars. We can't pay them to private businesses, but we can, to private entities, but we've tried to recognize and to help those that have stepped up all across the board. So I think it's great. I think it's really great stuff, and I'm really, really happy. And we have researched the ability to be able to use CARES money to go to private businesses and everything else like that. We've not found a way to be able to do that right yet, but from the standpoint of everything else we're doing, I applaud them and think that's great stuff.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is probably best answered by Dr. Amjad. Do we anticipate finding more of these probable and confirmed cases going forward? Is this something that we need to consider doing a top-to-bottom audit of all the data to find? Thank you.
Dr. Amjad, that's you.
Hey, Charles. I hope not, but we do have some backup checkup methods in place, and we're going to do some review to find out more. We do have a death report method of doing that, and we do have our backup system through Vital Statistics, and we're going to go back right now and double check all that. So we are going to look into some other methods so that this does not happen again, to answer your question. So we are going to find some other ways. We send out what we call a health alert to all the hospitals, the physicians, to remind them again that this is how you're supposed to report these immediately. But we're going to go back and review some more data to make sure, and also send it to everyone else again to remind them that this is how it has to be reported to us immediately. But we will also go back and review everything again. Thank you.
All right, thank you, Charles.
Dr. Amjad, maybe you could maybe you could add just a little bit more, but as this reporting is not done timely and not done properly and everything, could you elaborate a little bit more on that, please?
Sure, Governor. Basically, when someone does have COVID-19 and they pass away in a hospital, in a nursing home, or at home, there's a form to fill out. It's called a death report. And that's on our website, and most people are aware of that. And this happened several months ago. Some people might remember. That form is then given immediately to the local health department. The health department then immediately sends that to us at DHHR, which is how we put that up on our dashboard, which is then how the governor is able to, mention those daily. If that death report is not filled out and given to the local health department, which is then given to us, we don't know about it. Because most people are familiar with, death certificates, which somehow, can take days or sometimes weeks to fill out. But we are informed of it by a death report, which should be done immediately when someone passes away. Unfortunately, these that we came across came through our Vital Statistics data, which is also at DHHR, as they were reviewing some data. When we found these, most of them passed away at the hospital level or at the nursing home level. These entities did not fill out the reporting forms, which did not get to the health department level. And most of those reasons, I can only imagine, is due to the either lack of staff or some other issues, which why those forms were not filled out. And that is why it did not get to the health department level and then to us at our level. So we internally have been discussing ways of how maybe at vital registration or at our own level, how we can discover these at a faster level, because as time moves forward, we will need to find and make sure we can find out who these individuals are immediately as it should be. But all these checks and balances are in place so that we can find them, which is how we did at vital registration over the weekend. They were going over the records, they found these and realized those forms were not filled out at those levels as they were going through their reporting levels. So we have all these levels, they are in place, but as you can imagine, just like any forms, if it was not filled out and sent in normally, you can see the time lag. And I can only imagine those entities, for whatever reason, did not get filled out. But we're going to remind everyone again, they're very important. Find another system in place to back check it, because as you can imagine, it was a shock to us as well that those were not in our system. But we're going to find several ways to back check it as well. Thank you.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. It has again come to my attention that there is a deliberate attempt in Putnam County to flood the testing centers. In fact, there was testing going on today at Hurricane City Park from 9 to 1. But there were numerous posts on Facebook yesterday encouraging people to go out and test, not with the goal of identifying community spreaders, but with the goal of lowering the numbers, perhaps artificially inflating the number of negatives so that sports teams that are in the playoffs could play this week. I want to know if you've heard anything about this, what your reaction is to it, and from our medical professionals, is it proper for anyone to be doing this to try to artificially drive down the numbers? I realize you want to get a lot of people tested, but the motivation here seems not the same as yours.
Well, Mark, here's the thing, and again, you know me, I'm gonna just tell you what I think is the truth as best I possibly can, and I'm gonna tell you bluntly. The bottom line of the whole thing is just this: as far as weeding out, where people are trying to manipulate the system or multi-test or whatever like that, we'll get that done. We'll get that done. But the thing that is good about it is just this, is if we're circulating on social media to go get tested and everything, and maybe they're trying to get tested so that they can go back and play sports or whatever. Really, I don't care. I don't care. I love it, the fact that people are going to get tested. At the end of the day, Mark, that's the only way. And whatever the motivation may be, we'll weed out those that are trying to scam the system and all that kind of stuff. But really, when it really boils right down to it, what I am very, very hopeful of is the more we test, the more we learn, and we will find some. Let's just say we find 10 people that are, asymptomatic that are spreading this. What is the chances of one of those 10 spreading this to somebody that dies? Well, of course it's high. If we find 10, we found 85 in 1 week in Kanawha County. 85 people that didn't have any idea. I think that's the right number. 85 people didn't have any idea they had this. What is the likelihood that some of those 85 could have spread this, and people died? Well, it's high. It's high. So, if they're circulating on social media that we got to go out and we got to get tested because we got to play a ball game, are you kidding me? But at the end of the day, if they're doing that and they go get tested, great. I think it's good stuff, so, that's just my feelings. Maybe somebody from the medical community could weigh in, but that's my feelings. Dr. Amjad, or maybe Clay. If Clay's there, let Clay weigh in.
All right, sounds good. Thank you, Governor, and thank you, Mark. So I don't have much to add to what the governor said related to testing. Of course, we don't want to see people just going back over and over again as individuals just to try to reduce that, positive rate. But if getting sports teams back on the field motivates communities to get testing, so be it. This map and this county alert system is really meant to create that flywheel that the worse your metrics are, the more testing you do. It improves your metrics and also gives us the opportunity to identify the people that we said. But let's just remember, though, really, really remember that testing is one part of a successful strategy. But the other important part of a successful strategy is the commitment of people in communities to do the mitigation measures. Remember, mitigation measures: mask wearing correctly, physical distancing correctly, avoiding crowds, washing your hands, avoiding indoor environments as much as possible. And when you're indoors, wear your mask around other people, and reducing your interface, your connection with people you don't live with for it's 15 minutes cumulative in a 24-hour period of time at 6 feet or less. So that is a significant contact. So if we do those things and we test, then we will save many, many lives in West Virginia. We will get all the schools back in, and we will allow sports and other things to happen. It is really that simple, but it is really important that we all try to implement that in our own lives, because things are about to get worse in our country, and that also portends that things could definitely get worse in West Virginia.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Following up on Mark's question, I spent Saturday evening waiting for the map to come out, and I was messaging back and forth with Kevin Whiteman. He's the football coach at Frankfort High School in Mineral County. Sean White is the athletic director at Kaiser. He's also a good friend. And I was wondering, is there any limit? I know you kind of answered this with Mark, but would there be any prohibition or medical barrier to teams saying, hey, guys, we need to get our people out there and test, or else we're not going to be able to play this weekend, and we're both in the playoffs?
Okay, Paul, I can answer it. I think I can answer it, and it's just this: is I truly, not just their teams, but from the standpoint that their parents, from the standpoint of anybody that they come in contact with, the fans. I mean, if the teams could actually encourage people to get out there and test, that's exactly what we should be doing. I mean, that's the problem, Paul. I mean, what really and true, when we read it, I read it the other day, but how many of those sites did we show up to have? And I'm pushing these people beyond their limits, and they're tired and everything. And I am pushing the guard beyond its limits, and they're tired. And they show up to do this testing and everything. And we had situations where nobody showed up to get tested. Now, that's the exception rather than the rule. But, we had many, many situations where 37, 19, 12 showed up and everything. I mean, for crying out loud, Paul, if these teams are our key to be able not only to get the team tested or the coaches tested, but really way beyond that, their parents, the fans, if that really motivates and can help us within those counties and within those places to find these spreaders. And people say, well, I don't like being called a spreader. Well, I don't like to be called, heavy, but it's just fact. If you are asymptomatic and you don't know that you have this, you're spreading this. Now, if you want to be called Bo Peep or something like that, we'll call you that instead of spreader. But for crying out loud, we've got to identify these people. And if it's our ball teams, our coaches, the fans, somebody that can motivate in that county to get people out to test, more power to it. It's great stuff.
All right, thank you, Paul. Next to Chad Hedrick with WSAZ.
Hi there, Governor. Yeah, I wanted to follow up. The sports and the playoffs is obviously a big talking point right now. We know the SSAC announced Saturday that high school football teams in the orange and red counties would be able to play, and some changes had been made in that guidance. Teams from other sports have reached out to us saying they feel football's been given a special guidelines to play in playoffs while they haven't. So why not just say, give either here's a special guidelines for the playoffs in different scenarios and circumstances for all sports, or just say, this is what we've been following since the start of the season. This is how we're going to continue to do it. And because I guess some people they're saying to us, it feels it's a double standard for football versus a volleyball or cheerleading.
Okay. Was this Chad? Is that correct? Okay. Chad, listen, I don't know what's been posted with SSAC. I don't know where this came from and everything, because I heard just a little while ago the same kind of thing, but absolutely they cannot play if they're in the orange or the red. And it doesn't matter if it's football, it doesn't matter if it's volleyball. We are not going to discriminate between football and volleyball. It's ridiculous to do that, or cheering, and so I don't know where that came from. I absolutely don't know. I absolutely think with all in me that it's in error, and we'll try to clean it up. I heard about that earlier this morning, but I haven't had the opportunity to clean it up.
All right, thank you, Chad. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. Negotiations are still going on between Kroger and their union employees there, the UFCW Local 400. But after the union voted last week, it's beginning to seem more and more likely that a strike is probable. Now, to the best of my knowledge, nothing yet has been decided or announced as to whether or not a strike would also impact the Kroger pharmacies. But if a strike does occur and the pharmacies are impacted, being that they are a primary location where people get their flu shots, is there any expectation that this strike could negatively affect the administration of flu vaccinations as a whole? And if so, is there any discussion or plan pending to try to offset that impact? Thank you.
Well, first and foremost, let me just say this. I hope that good sense will prevail on both sides, and both sides will come to a resolution that will work for everybody. We all hope and pray for just that. But we all know, too, how important our pharmacies are to us, or flu shots, or the businesses that are distributing food. And so, if need be, whatever we would have to do, we'll do. I mean, that's just all there is to it. We will not let people go without their flu shots, or without their prescriptions, or inconvenienced beyond belief. And we will not let people surely go without being able to shop and get their groceries and that kind of stuff. And so when it really boils right down to it, we hope and pray that everybody's going to just use their good sense and come to a amenable resolution here. But we're monitoring the whole situation, and we'll do whatever we got to do. I mean, that's we've done it, and that's what we're going to continue to do. If the situation deems that we need to do something from the governor's standpoint, in those communities to be able to administer flu shots or whatever like that, we'll do whatever we got to do.
All right, thank you, Matthew. And last question today comes from Katie Coyne with the Charleston Gazette-Mail.
Thanks, Governor. So for the last two briefings, we've put a lot of stress on testing. And I want to be clear that I want to differentiate between incentivizing on a state level when we look at our rates, more on a personal level. But I've heard from health officers and others in the state that these testing events that the state asks counties to put on sometimes come with just 12-hour notice, which isn't a lot in rural places for people to organize transportation, get out, and some are saying that that's decreasing testing outcome. The other big problem here is there's no safety net. So if people get tested and they're positive, if they don't have jobs that let them take time off, they're really afraid of losing those jobs. We're putting a lot of emphasis on individuals getting testing, but what is the state doing to incentivize that on a personal level? Make it so they do get tested and they feel safe no matter what those results are, and making that testing as accessible as possible with more notice, transportation if needed, and stuff like that.
Okay, I'm sorry. I'm missing some of the question just because it's difficult to hear and everything. But as far as notification, of when the testing is going to be done, General Hoyer's not with us today and everything, and the Guard can and neither Secretary Crouch to be able to provide information on that. But again, here's what I would say. I would say, especially if you're watching and you're watching the daily stuff coming out, you've got to pretty well know that you're in the red or the orange or the gold. And we've told you repeatedly, we're going to set up sites in those counties, almost nonstop. Now, from the standpoint of you only getting 12 hours notice in those counties and everything, I hate to say it, but if you're watching what's going on in those counties and you're in the red or the orange and everything, and it may be a good idea for you to be tested, and we give you 12 hours notice that we're going to be at whatever site it may be, and it's relatively close to you, because we're trying to have multiple sites in the counties. And so if you've got that much notice and the situation that you've known it for days, that it looks like you're in the orange or whatever it may be, and you need to go get tested, you feel like you need to go get tested, I don't know how that we can make it any more easier for the people and be able to accomplish it with our National Guard and DHHR and the local health people. I mean, this is tough stuff, and they're running all over the place, and they're doing the very best they possibly can. All I would say to the people is just watch what's going on within your county all week long. Understand that this is something that none of us, do you not think, how much would I give to not be sitting here reading these names to you? How much would I give to be able to be working on the next project coming to West Virginia to bring jobs to West Virginia versus this? This pandemic is tough, and it's tough on all of us. But if you're out there and we're offering extended hours and we're offering all kinds of different ways that you can get tested, just please, just try within you to have all the patience that you could possibly have and try to keep abreast as to what's going on and be able to get to these places and get tested. I wish that we could give you 8 days notice and say we're going to be at the Walmart or the Blue Ridge Little League Park and we're going to be there 8 days from today. I wish I could give that to you, but the way this moves and how hard these people at the National Guard and DHHR and the local health people are working, they're doing the very best they can do, guys. I mean, that's all there is to it. And just so really try really hard to get there. I wish they could give more notice and everything, but and the other flip side of it, let me touch real quick on just this, because I think this was part of the question. What if I test positive? And if I test positive, could you go get another test, just in case you're worried about a false positive? Well, of course you can. Of course you can. So you can test again to make sure that you're positive. Now, so from the standpoint, that there's you should have some level of protection under the Federal Family Leave Act, and that may be a possibility too. But let's think about the practicality of this whole thing. You test positive and you're worried about a false positive. Well, you can retest. What if you test and you are positive and you have no symptoms at all? None at all. The likelihood of you getting sick is really high. Okay? But if you don't get sick, the likelihood of you infecting somebody else and them getting real sick is real high. So, I mean, let's be real about this. If you're worried about being positive, if you were positive and you truly are positive, you're probably going to get sick. But if you don't get sick, you're going to give it to somebody that's probably going to get sick, and the likelihood there could very well be, because you are reluctant to get a test, you could very well be giving it to somebody and somebody dying. Now, if you test positive, we'll retest. Absolutely, if you test positive, the likelihood of you getting sick is great. The likelihood if you don't get sick, you're going to give it to somebody that is going to get sick. I can't, if you're test positive and you're off for work for a little while and everything, I know that could be devastating beyond belief. And if it is, we've given you a path there and everything. But the bottom line is just this. If you're positive and you don't get sick and you continue to work, you're going to spread it all over the universe. We've got to stop it. We've got to stop it. And on top of that, if you're test positive and you're not sick today, the likelihood of you being sick is right around the corner. Doesn't make any sense. Doesn't make any sense. It's smart money. I know all of us, want to live in this vacuum where we don't really want to know. A lot of times you think, well, if I just stick my head in the sand, I won't know. But unfortunately, you'll probably know. And if you don't know, there'll be somebody along the trail that'll probably die because we didn't go get tested. Doesn't make a lot of sense to me. You got to be tested.
All right, thank you, Katie. Governor, I'll turn it back to you.
Okay, the thing I'm going to end up with today is, I've been through all the testing until I can't hardly talk, but I want to read this to you. This is on a press release, and I'll be real quick and everything, but this is about Pfizer. And I think everybody out there, because there's a lot of people out there that are listening in and listening to me and everything, but a lot of people out there are not getting the press releases from Pfizer and all this kind of stuff. But just from the standpoint of leaving you on as good a note as I can leave you today, just listen to this just a second. This is the Pfizer people that said, hopefully now we can move on and get this vaccine out there and make sure it's doing what it is supposed to do and stop the virus, said Catherine Jansen, Pfizer's head of vaccine research and development in an interview. The findings arrived on the timetable that the companies had been projecting. The results came too early for researchers to assess the safety of the vaccine, which the Food and Drug Administration says must include 2 months of monitoring at least half of the study's subjects for side effects. Pfizer said it remained on track to collect these 2 months of safety data during the 3rd week of November and could file for an emergency authorization shortly thereafter. So basically what that's saying is the 2-month period of data, they will have the 3rd week of November, and then they can file for an emergency authorization shortly thereafter. So far, in this 2-month period, so far, no serious safety issues have arisen in the study. The study has enrolled nearly 44,000 subjects in the United States and other countries. So there's 44,000 that were enrolled in the study. There has been no serious safety issues that have arisen in the study, the company says. It is unclear how long the protection the vaccine appears to last, so they don't know how long after you've received the vaccine that it will last, since researchers haven't studied the volunteers for very long, so they don't know. They just don't know. They know that it looks like there's no serious safety issues, and there's 44,000 that are in this studies from the U.S. and other countries, but they don't know how long it'll last. Naturally, they wouldn't, because, they've just given the vaccine to people. So the vaccine is relatively new. In fact, it's completely new. And it says, "You have been encouraged by this," said Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, who is on the FDA Vaccine Advisory Committee. "It certainly looks like things are trending in the direction for protection." And the last thing is just this. The timetable suggests the vaccine could go into distribution this month or next. So the vaccine could go into some level of distribution by the end of November or in December. And this is through the U.S. health regulators that have indicated that they will take some additional time to conduct their review. Then, after that, it will take months for these companies to make enough doses for the general population. So basically, what we're looking at is just this. And I'll summarize really quickly. You got 44,000 that are in the study. There's been very, very, very few serious side effects or anything that have happened whatsoever. The study is showing that 90+% of those that have received the vaccine have absolutely, it has worked, which is amazing beyond belief. You've got different people weighing in, from people at the Children's Hospital in Philadelphia to all the Pfizer experts and everything, and saying how excited everybody is that this is really going to work. And from a timetable standpoint, there could be some distribution out by the end of November, and it will probably go to the elderly or the first responders first and foremost. And then absolutely right after that, we will have more and more and more to come, and you'll have more in December and more in January and probably more in February, and by that time, we should be good to go. Now, we all know things like this can change, but this is terrific news, and you can see it all across this world. So we're going to continue to hope and pray that this is the answer to get rid of this nasty thing. And so as we hope and pray for this, we'll surely keep all those that we've lost in our thoughts and prayers. And if we do not continue to wear our mask and stay and follow the guidelines, and absolutely without any question, if we don't go get tested, we're going to lose more than we should have. That's all there is to it. We're still going to lose people. But without any question, if we don't go get tested, we're going to lose more than we should have. So anyway, thank you all so much, and stay at it, West Virginia. You're doing good. I'm really proud of you. Thank you so much. Bye-bye.